The broadcast is now starting. All attendees are in listen-only mode.
Hello, this is Alex. We will be starting here in just a few minutes. We're going to let a few more people jump in here. Okay, I am going to get started here a little bit. Hopefully everybody can hear me. But my name is Alex. We're going to start here right at the top of the hour, but I am going to just let everybody know. Here are the questions. Feel free to ask, and I will answer as we go. And if you want me to say it out loud, let me know. If you just privately, let me know, and we'll go from there. Okay, we are at the top of the hour. So, and I know we have some more people that will start, keep trickling in here. So we're just going to keep it going. Again, my name's Alex. I am the National Health Sales Director for the Medicare side of things here at IAMS. I've been doing this actually for quite some time myself. IAMS has always had Medicare, but it's been more of a service, if you will. It's not really been an enormous focus of IAMS. As everybody knows, we're really well known for our life and annuity side and what we do there. But I'm actually I'm brought on board. Like I said, I've been doing the Medicare products for quite some time now. I've been working with them, working with a lot of different agents, agencies. Actually, the brokerage I come from, that was their sole focus was the Medicare side. So uh, came on board here with IAMS and helping us really drive and kickstart the Medicare side because due to a lot of our life and annuity agents and agencies, top producers to soft producers, whatever you want to call it, uh, they have requested that we get more aggressive into it due to the kind of service and support we do bring our agents on a day-to-day basis. They wanted us to get into the Medicare side to really help them grow. So today I'm going to show you, I'm going to kind of walk down this flyer. Everybody should be able to see this. If you're not, if you could please make sure you send me a message quick because I want to make sure I can get it fixed. Um, but I'm going to show you a few screens. We're going to go over this entire list right here of how IAMS can fit in here and what we could do to help. And then I'm also going to go over our CSG tool and it's one of the tools that we provide you free of charge with working with us. Oh, sorry. And now everybody should be able to see the screen. Okay. So starting first, as you can see here, lead program. We do have a lead program. We have three different actual lead programs, which is really nice. Typically, IMOs, FMOs like ours, you will only see they typically have one lead program. Some don't even do lead programs. We actually do three, and they're three different types. I'll kind of go in row. One is just a typical 1,000-piece lead mailer. It is it's a direct mail piece. They are responses directly back from clients. 1,000-piece lead mailers. I think the national average right now is a 2 to 3% response, but there are no guarantees on that. But it is by far still the more popular of lead distributing and lead marketing, if you will, out there for the Medicare side. Our second is our bulk lead mailer, which is actually my favorite. And the reason why is because that is actually guaranteeing you 20 leads. You have to buy a minimum of 20. Turning 65 leads are $18 a piece. 66 plus are $16 a piece. The company we're actually partnered with, Pinnacle Financial Services, a lot of you that are on this are already working with us, and I've explained to you, Pinnacle Financial Services is actually partnered with us. They actually help me with a lot of the back office stuff that I do here underneath IAMS. They're Medicare shopping themselves as well. Um, and they actually, like I said, they handle our back office. They don't do anything with the sales, but they do a lot of back office. They do a lot of contracting, new business, things like that, that really help me out here underneath IAMS as we continue to grow this department. But they are in charge of also running the lead program with us. And so those direct mail bulk pieces, they will help you with the purchasing of them, getting them distributed, and really getting it set up. And the company that we're partnered with Pinnacle, the lead company, that's what we have built together. Again, is this 20-piece lead mailer. You're guaranteed 20 leads. So when you buy 20, you're getting 20. Now, if you go over the 20, you are responsible for that purchase, which is not that big a deal. If you actually do somehow receive less than 20, which is rare, but in the event that, because they have so much time to fulfill your order, if they cannot fulfill it, they will actually credit you those leads back. And that's a really nice program because a lot of 1,000-piece direct lead mailers, they don't, and typical lead programs, they do not credit that back. They usually do not offer a guarantee, where this is actually a guarantee of leads back. So I really like that program. Typical lead mailer is $450 to $500. This is, you're going to be spending about $340, $360. So you're saving money right off the bat. You're getting a guaranteed amount of leads. In the event that you call and call and call, or it's bad data, bad name, whatever it may be, basically it's classified as a bad lead, which they have their ways of venting that themselves. They will also credit you that lead back as well, which is really nice. Um, the Medicare supplement, Medicare Advantage comparison enrollment tools. I'm going to go over the MedSup one today, and then I'm also going to be setting up a webinar again shortly to go over the Medicare Advantage, just because they're both very in depth of one another and different. But we are going to go over the MedSup one here in just a little bit. The calling list program, that's the third lead program that we have. It is a data company that we use. It gets you your raw data, if you will, of names, numbers. A lot of agents use this to hammer the phones and calling clients. A lot of agents I've seen, they actually do their own types of marketing, their own postage, especially if they own an agency or trying to really get their presence really well known in the area. They will draw up their own marketing pieces, their own postcards, whatever it may be, use these data lists to combine to those lead pieces to the marketing of their own, and to blast that out whatever way it may be. You can again call them, email them. It comes with all the different data, and it's actually scrubbed against a couple other databases, so the accuracy tends to be a little bit higher than the typical data company. And again, with being just contracted through us, everybody has access to these programs I'm talking about here. Our Social Security program and training is really one and the same. IAMS is rolling out. It is $2,500 for 25 buying units. This is a really good opportunity because as agents are discussing Social Security, that conversation always easily rolls into Medicare, because that's essentially what we're ramping up is the Medicare sales, which in a lot of agents, they actually use Medicare as the foot in the door to cross sell over to the life and annuity side. Medicare is a different kind of need than life and annuities. Medicare, at some point in time, somebody's going to have Medicare. They are going to retire. They're going to no longer be working. They are going to have to come off group insurance, whatever it may be, to roll over to their Medicare services. So, where life and annuities, you don't have to have life insurance. You should have it. You do need it, but you don't have to have it. Annuities, you don't have to have an annuity. You should want it. They're beneficial. They do. It's a different life and annuities are a different kind of need than the Medicare. At some point in time, you have to have a Medicare plan. So a lot of agents use Medicare as a foot in the door. This Social Security program, training and seminar, and we have sent out quite a bit of marketing on that. If not, you can ask me about it, and I can definitely send it over to you. But this is a program, $2,500 guarantees 25 buying units. We will be more than willing to share that with you and show you exactly what that is. But again, to mention on it, Medicare, fantastic foot in the door to cross over to life and annuities. Some of my best agents I've ever had that are the most successful on the Medicare side is because that's exactly what they do, is they use Medicare as their foot in the door to roll over. A lot of agents will question what's the best time to reach out to a Medicare client. Uh, I've had a lot of agents talk to me since I've been underneath IAMS, and outside of a Social Security kind of training in person training, they're always wondering if I'm going to do just regular marketing, what's the best time to reach out to an agent? I always tell my agents 6 to 9 months out. A lot of Medicare is from carriers to government to agents and agencies. The most common time an agent reaches out is 3 to 6 months out, and that's when your responses drop drastically. That's when a lot of agents will say my responses are significantly lower. I'm not able to get a hold of clients. I'm not hearing from the clients. I'm buying all this money in marketing and I'm not getting anywhere with it. That's because your marketing is one of however many they're also receiving. I actually have a story to go with it. I wish I still had the picture. One of my agents I used to work with, his neighbor turned 65. He was always going to have his neighbor, my agent, write his policy. But he wanted to show him, I want to show you how much mail I have received, how much marketing I have received on turning 65 here. And he had a mountain of mail that was just coming. His mailbox was just over full. And it wasn't just agents buying, agent leads and agent marketing. It was carrier leads and marketing. It was government leads and marketing. And it just completely oversaturates the client to the point where they just, your responses are just going to be very low because eventually they're just going to pick one of the cards anyway, or they're going to reach out because it's just overbearing. So I tell my agents 6 to 9 months out because you can write a policy 3 months before, the month of, and 3 months after they turn 65 or hit their plan B or their part B, I'm sorry. If you reach out 6 to 9 months out, you're able to get a hold of that client, build your pipeline, as you'll hear me say many, many times. Medicare is all about building your pipeline to get in there and explain to them what Medicare is, essentially walk them through all the steps of Medicare and what they're enrolling into, to then go, we can't write this policy right now, but I'm going to follow up with you here, and this is where you as the agent, pick your date and times available to come back out to the client to write the Medicare policy. But before you leave the house, that's then when you immediately roll that conversation into life and annuities to immediately grab that life and annuity prospect. So again, I can go over that more in depth later with you guys and really explain how it works and what you can do to maximize your opportunity there. But that's what a lot of the really successful agents will do, is use that Medicare as that foot in the door to cross over to life and annuities. Going down one more, you'll see top-notch back office support. The top-notch back office support agents and I do see quite a bit of agents on here that are already currently working with us, and I do see some new ones. Everybody that works with IAMS knows exactly how our back office works. We do not, and I always challenge my agents to this. Call in here between the normal hours of 8 to 5 Central Standard Time, and I challenge you to tell me on average how many times that phone will ring before someone picks up the phone. We've heard it many, many times where agents get contracted with their IMO, FMO, and they never hear from them again. They don't know who they're working with. They call and it goes into a voicemail and then never gets returned. IAMS steps aside from that, and that's where we stand away from everybody else. And I will tell you, when you call in here, that phone will not ring more than 3 times, unless during the hours of 8 to 5, before someone picks up the phone to work with you. So not only are we here and we're attentive to our agents and everybody works together, but on top of our admin support that we do have, our contracting, new business, everything from the life and annuity side over now to the Medicare side, regardless of what it may be. When you call into insurance agency marketing services, that phone will not ring more than 3 times before someone picks up. And that's just really a service that's really been lost in the IMO, FMO world. Um, I will tell you myself personally, coming over to IAMS and being here a little over 3 months now, I'm still getting used to not having a voicemail. Uh, but I do see the huge value it brings to a lot of the agents and the respect that they have for us regarding that. Website design. As you can see, this beautiful flyer here that we're all looking at, that is from our creative team. They not only can help you build pieces like this to help you advertise and brand yourself. If you want to take something like this yourself, they are here to help you on top of website development. I cannot tell you how many times our agents have appreciated knowing we can help them build and design a website of their own. On the Medicare side, we're still working on it. We do not have a marketing dollar yet. We will, but we have not yet been able to nail that down. We're looking at potentially beginning to middle of next year being able to build up a program to where you can get marketing dollars. But on our life and annuity side, for every dollars amount of premium you submit, you will get an extra amount of dollars of marketing in your account. That marketing go to offset your expenses like leads or again, this website design. Our website design, a lot of our agents, and we do have some examples, have really taken advantage of our creative team and really worked with them to help with their branding, their marketing, their exposure in the market, especially with everything heading towards the internet and being more of a digital type. This is a really great tool and a really great service that we offer that I strongly suggest agents take advantage of when they can. I'm going to wait here. I know sometimes I speak a little fast. I do apologize. Um, See if we have any other questions that come up. I just had an agent ask, out of the bulk lead mails of 20, how many policies are they writing out of that 20? Again, there will never be a guarantee on that. I can only give averages of the feedback I have received, but I have had actually a lot of agents have a lot of success with that bulk lead mail, and I strongly suggest everybody take a look at that. I just had an agent tell me the other day he closed 6 of the 20. So if we look at it and when we break this down, because everybody wants to know cost versus marketing, because marketing can be expensive, he paid 300. His in total lead cost came out to $345 and some odd cents. He wrote 6 just Medicare policies alone, Medicare supplements alone. One MedSup would cover the cost of the leads. That's 5 others in the pocket. All money in the pocket for him. That also does not include, he did roll a couple over to life policies and he did get an annuity policy out of it. On top of, we are offering products like hospital indemnity products for our Medicare Advantage side. Cancer, heart attack, stroke. Our cancer, heart attack, stroke plans we have are phenomenal. If you actually look at the cost versus what the benefit is for cancer, heart attack, stroke, you will see a significant need there. Dental, vision, hearing. Medico actually put out Medico company. I'm sure a lot have heard. They're really big in the Medicare supplement world as well. They put out a statistic that only 33% of senior households over the age of 65 actually have dental, vision, hearing coverage. Why? Because agents, for some reason, just do not bring it up to their clients. And I strongly suggest when you're in for a Medicare supplement plan, I always suggest bring up your cancer, heart attack, stroke, dental, vision, hearing. That is your time to really get those the coverage, again, the benefits versus the cost, it just makes complete sense that if you can see the need to really push that product, both of those products. And again, it's all about your opportunity, taking full advantage of your opportunity, but also giving the clients exactly what they need. If you think about it, 30% of people have dental vision hearing coverage. Only 30% dentures, other dental needs, but especially like dentures. How many people do you know over the age of 65, maybe when they reach 75, 80, somewhere in there that potentially need dentures? If they had a dental vision hearing coverage, they would save significant amount of money versus not having it. Versus what you and a lot of dental vision hearing plans I'm seeing are only another $8 to $12 a month. With the benefits that they're getting, it's just a phenomenal product. Cancer, heart attack, stroke. A lot of clients will, they are worried about that. They it's in their family. It's in their. They know they have a history of it. Cancer, heart attack, stroke is exactly what it covers. It covers it's basically a pocket of insurance to cover you financially in the event one of those things were to happen. And again, if you take a look at the cost versus benefit, it's a great product to cross sell with. Okay, I'm reviewing one question right now. Hold on, I need to get Sean back here. My questions are not working very well. Hold 1 second. Okay, sorry about that. I just had to get that fixed. Okay, so I had one question here. What is required to sell Medicare supplements? Medicare supplements actually only require a health license. As long as you have your life and health license, you can sell Medicare supplements. Medicare Advantage is the one that's heavily CMS compliant. It takes not only your AHIP certification through CMS, but also a product certification through the carrier. So with a Medicare supplement, all that is required is a health license to sell over to that. And I know a lot of times agents, just through whatever it may be, whatever channel they're going through, sometimes there's some confusion there that all Medicare takes those extra certifications. What about all the certifications needed to sell in the market? Yep. So, David, I do see your question there. Again, certifications, that is only for Medicare Advantage. Now, Medicare Advantage, I will tell you, is a very popular product as well, and I do push that heavily. In my opinion, an insurance agent should have anywhere between 3 and 5 carriers. And let me kind of explain to you why. There's all different types of clients out there, okay? Medicare Advantage is the network-based insurance, HMO, PPO. Okay, that's one that's heavily regulated by CMS. A lot of times it's zero premium. The max out of pocket a plan can have right now is $6,800 out of pocket. Okay, when it was first ever brought in, it was really meant for people that were hurting financially, right? Or not necessarily hurting, but just didn't have all the excess funds to add on an extra bill like a Medicare supplement is. A Medicare supplement, though, versus Medicare Advantage, and we'll talk about that again. A Medicare supplements now that there's a plan called Plan G that rolled out, and I will show you that here when I hop over to the other tool, it is very inexpensive now compared to what it used to be. But Medicare Advantage is HMO PPO. Well, a lot of people that are still conservative, not necessarily that they couldn't add an extra bill, whatever it may be, a lot of conservatives, whatever it may be, Medicare Advantage is actually quite popular. Actually, last year sold, it was 50-50 for med subs versus Medicare Advantage. So when you put in that perspective, yes, you are going to have, and I truly believe with enough of selling of one type of product, you're going to inevitably have another line of product. Okay. So with enough med subs, there's going to come the need for Medicare Advantage. Some agents only write Medicare Advantage. Well, writing so many Medicare Advantages inevitably is going to roll over to the need of Medicare supplements. So again, I always say 5 carriers. I always look at it's network based, right? It's county and network based. We look at your county, we take 1 to 2 Medicare Advantage products, right? There's really not a reason to have more than that unless you live in a very, very, very large city like Miami, for example. Okay. I always suggest we look at 1 to 2. And then I say anywhere between 3 and 4 med sup carriers. And the reason why Medicare supplements are all different. Okay. You're going to have your clients that say, I'm healthy as a horse. I want a Medicare supplement because I live in Michigan, but I go down to Florida every year. I want to make sure that if I go down there and sprain my ankle or whatever it may be, I'm covered and don't have to pay a lot out of pocket. Okay. I don't have to worry about the network. Medicare supplement, as long as I hand over my card, I'm good to go. We have your carriers for that, okay, where they just come in real low. That's your people that are 65 typically saying, they're still healthy, don't need to worry about it. They just want something to cover in the event that something happens. We have your carriers like Lumico, for example, for that, okay? Lumico is a great company. They are a little bit newer, but they're actually backed by Swiss Re, which is the largest reinsurer in the world. They're the kind of and so their financial backing is extremely strong to help out for the client that just wants to pay a low rate. Then we have your clients, okay? That's one type of client. Then your second client will be the type of client that says cost isn't the big thing to me. I want a name brand company behind me. I want a Mutual of Omaha. I want an Aetna, Cigna, whoever it may be, United Healthcare, AARP. I want that kind of name behind me. That's what I want. We have all those carriers. We have all those big name carriers that a lot of clients typically tend to choose. And then we have the carriers that go, yes, I want a Medicare supplement, but I'm also concerned. I want to make sure that the carrier is prepped. There's a lot of cancer, heart attack, stroke, or whatever it may be in my family. I want a carrier that's a little bit more lenient when it comes to those kinds of policies. We do have the carriers for that, like a Bankers Fidelity and GTL. Not that they necessarily look for, and I don't like classifying it as sick people because that's not what I don't like saying it like that, but that's what they typically say. But they are more lenient when it comes to that. Prime example: Bankers Fidelity takes up to 10 units of insulin. Okay, that's phenomenal. I'm sorry, 10 to 50 units of insulin. Okay, for diabetics, that's a great company, and they have very stable rates when it comes to those kinds of products. So we have the whole blanket of carriers that you possibly need to work with, um, and that should not be of the biggest concern there. Okay, I'm reading from Scott Bruce. Back office, and I can read this out loud. Back office support from an administrative perspective is one thing. Expertise in the areas of Social Security, Medicare, life insurance, and annuities are something else. Does IAMS provide this sort of support as well? Yes, we do. Actually, one thing that's always very much impressed me about IAMS since I've started working here, I've been a broker now for about 9 years. Okay, and one thing that's impressed me significantly about our life and annuity side is I've heard many agents call in and say, I have a client that needs X. Well, actually, through our marketers working with the agents, sometimes a marketer can steer you to say, yes, that would be a good route, but take a look over here. If we actually choose this product with this carrier, this would actually give them a better outcome than the other product, or a different kind of outcome than the other product. So yes, actually, and I completely agree with you. Having the support versus perfecting the support is two different things. And yes, I can honestly say I believe our not only our contracting and new business staff have it perfected and will be able to take care of anything you may need, but also same with our sales side. An IMO FMO, okay, the what they should be out there to do, and this is any upline like myself should be able to help someone, Scott, David, everybody that's on this webinar. An IMO FMO is here to relieve you as the agent of all the carrier, basically take as much off your plate as possible that we can, from a sales to back office administrative side as we can, so that way you can get out there and focus on your clients and marketing yourself. That's also big on the Medicare side. Medicare is a very fast-paced, bulk uh, kind of business. Okay, so when you're out there seeing potentially, the average agent is writing anywhere between 3 and 5 apps a week. We need when you're doing your travel time or your backup, your own personal back office time of lining up for your clients and your meetings. We have to do everything we can when that business gets submitted or that contract gets submitted to eliminate as much of that back office ourselves. Same thing with sales. We're here to help you steer everything that it may need. On the Medicare side, myself, when a client comes in and says, "Hey, I want X carrier," sometimes I say, here's the thing, because of the way your family, your history is, maybe take a look at this carrier because this is the way that they operate. So, no, we that most certainly can help with stuff like that. And yes, we are uh, very well. Oh, how do I want to explain this? We're very well trained and very well knowledgeable of the market and can help you on all different aspects of the business for you as an agent. Okay, I just had someone ask the same thing again. I don't know if they didn't hear me from before, so I will go over it. The certification for the market, you only need your Medicare. For Medicare supplements, you only need your health license to sell it. Some agents ask as well, how many clients do I need to see to make it worthwhile bringing Medicare into my realm of business? I answer that with two different questions. One, all your clients are going to turn 65 at some point and retire. Are you really going to let another agent work with your clients? And the reason why I say that, a lot of agents represent under 65, over 65 health insurances, as well as life and annuities. Your clients, you've obviously built a relationship with them and you want to do everything you can to keep it. And honestly, let's face it, you want to keep other agents out from your client base. So I would say yes, Medicare supplements especially are a very strong product to keep with it as well, not only to find more clients, but to service the existing clients that you have. Um, they say there's 60,000 people turning 65 every day, and I need to go back and I'm going to make sure we have that statistic still correct. To me, when you look at it from the revenue stream, because I know that was something we were going to talk about here on the webinar, is the revenue. It makes complete sense. If you yourself in the next 60 days could write anywhere between 3 to 6 applications, whether that's couples, individuals, whatever the combination may be, yes, it is very much worth you to bring it into your realm of business. It's very much worth it. The average street level commission, this is beginning commissions, is 22%. Okay, that 22% usually pays out. A commission schedule sees first year and then years 2 through 7 at 22%. So let's say in the average, I guess I should say premium is anywhere between $1,800 and $2,200. Okay, so one app, no, is not gonna be the biggest source of revenue for you. But what I would always question and challenge you on is that one app. What could you also get out of life and annuities, cross-selling over to cancer, dental, vision, hearing? But an average agent writes anywhere between about 100 to 150 apps a year. So take that 22% by the 100 into 150 off of, I would say, about a 2,000, just hit the middle, $2,000 premium. Do the math there and then times that by 7, because that same dollar amount will on average pay you out between 5 and 7 years before it drops down. In typically a Medicare policy pays up to 10 years, which then only drops down to about I think it typically drops down to about 5 to 7% from there. Medicare Advantage pays you, I think that it's by enrollment, it's not by premium. Medicare Advantage pays you, the carriers pay up to $510 for new to 65. I'm sorry, new to Medicare, and then their half of that is your residual for the life of the policy as long as that client stays with you. And there isn't a time limit on that. So doing the math there with the clients you could see or prospects you could see, when you're talking Medicare, Medicare is your revenue, your residual revenue stream, where life and annuities really only pays first year. And the life and annuity agents are essentially having to start every year to begin with. They're having to restart every year, making their income. Where Medicare, if you made $5,000 this year, you're going to immediately make $5,000 next year as long as those clients stay with you, which they typically do. Clients really don't flip policies until I would say about 68 to 70 in there is when they start to see rate increases or their health has changed and they need the agents to come back to them and review with them at that point in time. I want to flip over to my CSG tool, but I want to make sure I got all the questions answered. Okay. So next we are going to go over our CSG tool. This is a tool and a lot of agents already have it. This is actually a $1,200 value, the one that we have, that we actually pay for you get free of charge working with us, contracting with us. This tool is a live quoting tool. It's live for you. It's instant. So a lot of agents, a lot of times what I'm running into, the ones that still use paper, is they have outdated rates, and sometimes they have to go back and work with the client again because the application that they have is out of date and rates have changed. This tool is going to eliminate that. Here in the next couple of days, I actually will have a tablet-friendly one, Google Play and Apple Store friendly tablet and phone version of this. A lot of agents that I've worked with, especially at the previous place I worked at, they will have a tablet dedicated to their Medicare side of things. And the reason why is because this will eliminate a lot of the luggage and stuff you have to carry with you, and it's instant. And I'll kind of explain to you what I mean by instant from there. So this tool, again, we give you a free charge for working with us, and I strongly suggest, even if you're having to pay for it right now, let us take that expense off your hands. You will see IAMS, we have our own branded one right here. I'll kind of go through all of these if you'd like. Medicare supplement, we'll just click on that to begin with. Okay. And this is how easy it is. I'll run my zip code myself. This is where I live. We'll do a 65 male Plan G. Plan Gs are the more popular plans in Medicare right now. So you'll pull up all these. Plan F is actually going away after 2020. I'm sure some of you have seen about MACRA that's hitting in 2020. Long story short, Plan F is going away. Plan G, because it's significantly inexpensive. Yes, you are having to pay that Part B deductible versus a Plan F. But when you add that Part B deductible, which is $183 plus their monthly rate, your client's going to save a couple $100 a year for the exact same coverage, except for that Part B deductible. So I'm going to do a Plan G. We'll sort by price. We'll apply the discount. You can come down here and you can pick the effective date. So let's say it's October 1. To get the live rates for October 1. Oh, that's November. And you can to personalize it, you can put the client's name in here. So as it's loading, so you'll see actually right here. So actually, if you saw that quick screen flip, it's because it actually applied the household discount, which that household discount is what you'll see it right here, HH discount. These are the discounts all the carriers have. And it'll tell you what carriers in the area. So Continental Life Insurance of Brentwood, Tennessee, that's Aetna. That's Aetna Group. It tells you the parent company. It tells you their rating, their attained age, how many years have they been in the market. Okay, they do have a $20 policy fee versus Central States and Health Insurance of Omaha. They have a $25 policy fee. Okay, Over here, compare quotes. You're going to see this. You don't really do anything with these. Export. You could print off this sheet for your clients if you're wanting to see them face to face. A PDF so you can email it to your clients ahead of time working with them. A lot of times agents, because this tool actually gives you the ability to sell over the phone. This tool gives you the ability, oops, I need to flip that over. There we go. This tool gives you the ability to sell over the phone. This, which a lot of agents do. So what they'll do is they will get a PDF of the brochure, add to PDF. It'll load right down here. And you'll see right here a PDF of exactly what the exact same sheet that you have there. So a lot of agents, what they'll do is they'll take these PDFs, put in an email it over to the client as they're talking to them on the phone. Again, they'll have Mrs. Jones on there, kind of personalize a little bit for them. Or I guess I'm sorry, I should say Mr. Jones, just because we did a mail. Okay, and you'll see it right there. Over here, expand quotes. If you want to see more carriers before you go into everything, you can hit that. It'll shrink it. I always keep it expanded just so I can walk through everything. Here's a really cool feature. So say your client says, I'm healthy as a horse. I want an A-rated company behind me. I want someone with really strong financial backing. Perfect. You go with Aetna. You can actually pull up the plan details. I really like this because agents, as they're explaining to clients what they're buying, what Medicare is, why they're getting it. Here's your Part A. Medicare pays this. This is what your Part A pays for. This plan is the Aetna plan that they're buying. So outside of this plan that they have in their part, this is what they pay out of pocket. Really cool feature. Same thing with Part B. Medicare pays this. This plan pays this. All you're responsible for, I'm sorry, it's a $185 deductible, right? Boom. I love this tool because it really breaks it down for clients when you're sitting with them to say, this is what your Medicare Part A and what your Part B is paying for. We're paying for this Medicare supplement monthly. You're going to spend, uh, where is it? $104.35 a month, or you can come over here and click on annual rate, or you're going to spend $1,252.71 a year plus a $183 deductible. That's all you're going to pay for, and everything's going to be covered. You go to the doctor, hand them your card, you're covered as long as you pay these. Really cool tool to use. Market analytics. This will show you everything about the carriers, age increases, when they typically see an age increase. Okay, so on average, at Philadelphia American seeing a 1.8% rate increase. Or this is when they're typically nationally, I guess I should say, this is the average increase that they're taking nationally. Increase history, this is this state. They're actually going decreasing. They're decreasing their rate. That's pretty nice to see. You can see right here, national lives. And this is a little bit skewed. Okay, 2018, they definitely had more than 172 people. I'm not quite sure how this breaks down. They explained to me once before, and I need to ask CSG, the company, again, what this is. But this will tell you everything else you need to know right here. Okay, the market percentage of what they owe, whatever it may be. Sometimes clients like to see this. Again, you can click through all this. Here's what's a really good feature, the really cool feature about CSG. Your client wants Aetna. You click on carrier resources. This is taking you directly to the eApp platform for the carrier. Okay? This is taking you exactly where you need to go to write the eApp. The reason why eApps are really nice for Medicare. Okay? eApps don't let you make mistakes. They get submitted direct to the carrier. A lot of times when you write an eApp in that same meeting, especially if you're starting to talk life and annuity products, your clients will know by the end of your meeting because of the kickback message you'll get if your client's been accepted or not. It on average takes about 15 to 20 minutes for a carrier to come back to you and say if that client's been accepted or not. Not all carriers have this feature yet, but the majority of them are bringing this up. And again, it's because it's all electronic. So the reason why I push this tool is because it's not like life insurance. Life insurance has so many different variables to it. You need to call in here and help us quote for you and let us quote with you Whereas Medicare, as you can see here, all it takes is what's their zip code, how old are they, male, female, smoke or not, what plan do they want, an effective date, and you can sort by price, ratings, company name, whatever it may be. Hit get quote, instant results. Write an e-app, instant results. I mean, you're going to be told within, like I said, on average of 15 to 20 minutes if your client's been approved or not. So by the time you even leave that house, if it tells you that that client is disapproved, which at the age of 65, they don't have to worry about it. They're automatically enrolled. They get one open enrollment, if you will, which is similar to guaranteed issue. They are two different things. Guaranteed issue and open enrollment, and we can go over the enrollments some other time when we're talking offline. But everybody is guaranteed no underwriting, no health questions, automatically guaranteed a policy. You don't have to worry about that carrier come back and saying up their decline. The only time that you have to worry about that is when you're writing them after they turn 65 and they want to flip plans. Medicare supplements can be sold all year round. That's not like Medicare Advantage. Medicare Advantage is October to December. Med sups are sold all year round. Clients get flipping and out of them whenever they feel the need. So this tool is extremely useful from a laptop, tablet, however you want to work. I strongly suggest you don't do an e-app over the phone, on a phone, cell phone, even if you have a big phone like myself. But whatever helps you get your job done is what you're more than willing to do. Here's another cool feature that I want to go over real quick. Conditions. When your client is over, so let's say for the sake of argument, Mr. Jones turns 68. Okay, get a quote. Okay, you'll see some of the carriers change where they come in. Now Medico's coming in, 103.93. Pretty inexpensive. 12% household discount. That's the reason why it's so low. Okay, without the discount, you could tell them it's gonna be, Medico drops off a little bit. Okay, say for the sake of argument, they're both applying together again. Medico, right? Maybe we're hinting at that, but all of a sudden they tell you they have, you know, whatever disease it may be, arterial disease. Okay, Medico still accepts them. It tells you a category, criteria, look back period. They don't consider it. Don't need to worry about it. Let's get rid of that. Let's say, oh, we froze up here. Oh, computer's jumping around on me. Give me 1 second. There we go. Say they've had a stroke. It's not going to work with me. There we go. Tells you exactly right here what it looks at. Or it'll eliminate the carriers if the carriers won't look back at it. You can see right here, Medico's only going to look back on that client for 2 years. Prosperity Life is going to look back on that client for 5 years. Okay? This is a really good feature of this tool because, again, it helps you eliminate questions right off the bat before you even go in there. Hi, Mr. Jones. Hey, I wrote you when you were 65. What's happened with your health? You're 68 now. What's potentially happened with your health? Diabetes. That's a really big one. You'll see Medical looks back every 5 years. Central States, every 50 units of insulin of this isn't necessarily a look back period. This is what they're telling you that they will accept. Okay? So again, it's a really nice feature here to work with the MedSup side. I strongly suggest agents take advantage of this. Again, we pay for this free of charge for you to work with us. I have about 14 minutes here left, so I want to make sure I answer any questions that may be coming on. Nope, nothing. Okay. Final expense. A lot of agents talk to me about final expense. They want to talk about, life insurance and Medicare is a great cross sell. Here's a quick final expense tool. We do have male, Mr. Jones again. He's 65, right? You can do it by monthly rate or face value. Say he wants to add $20,000 worth of final expense. Tells you right here, graded. Say he wants guaranteed. It's guaranteed issue because some things maybe in his life now uh, that calls for that. Boom, right here. Include the app fees. Me personally, I would rate Great Western. Great Western is a great company for their guaranteed issue clients. So is Gerber. Gerber's another great one. So actually, I guess I take that back. I would maybe go Gerber, guaranteed West, Great Western, whatever whatever the you as the agent is comfortable with. Okay. So I went 40,000. I believe it cuts off right about there. Again, Great Western's only one in the area. Tells you exactly what it is. Plan details. Everything you need to know. They pay it annually or monthly. Now, Medicare Advantage is on here. If my agents that are writing Medicare Advantage on here are with me right now, Medicare Advantage, it'll tell you exactly the county that they're in. If for some reason that zip code has more than one county affiliated with it, there'll be a drop-down menu. You can pick exactly the county that they're in. Okay, Mr. Jones again. Here you go. Tells you all the Medicare Advantages in this county. Aetna's HMO plan, Aetna's Coventry's Healthcare, PPO, United Healthcare's HMO. Tell you the different plans that they have and the details about them. $3,400 max out of pocket. $0 drug deductible. Dental vision hearing we talked about. 68135 again. From Mr. Jones. And a lot of MedSup carriers like Mutual of Omaha, they have a dental plan tied into their Medicare supplement that you can take advantage of. There are some discounts that come with that. That'll all be in the application versus right here. But this will tell you the competitive carriers in your area for the dental vision hearing products. So this is the time. I will wait to see if we have any questions here. And I know I went through this very quickly, but I only had about an hour to get it all in. So any questions, you can definitely call me offline, email me. I will be following up with everybody that was on this webinar. I'll get a list of everybody and call and see if there's anything you need me to go back over. I went too fast on. Sometimes I'm a little bit of a talker, so I need to, go over things again. And don't hesitate to let me know. I want to help out. A lot of our agents here at IAMS are taking on from the life annuity side are taking on Medicare products with us. They're taking advantage of it and appreciating how well it fits into their routine, especially the agents that are interested in doing Social Security seminars. Again, pull this up, see if anybody has any questions regarding this. Okay. Well, I don't believe I have any more questions here from anybody that I'm seeing. And it looks like I have some people even dropping off. So I'll sit on here for a few more minutes and see if there's any questions that come through. Otherwise, here shortly or at the top of the hour, I'll be getting back to my desk if you want to call in. I do think we're going to have quite a few people coming to call. So, like I said, just call in, leave a voicemail for or leave a message for me if you need to, and we will go from there. And thank you for joining me today. Thanks.